He has extensive experience with animal disease outbreaks, including Salmonella enteritis, foot and mouth disease in England, low pathogenic avian influenza, exotic Newcastle disease, and high path avian influenza. Dr. Scheer received a Bachelor of Science in Biology and Chemistry and a Doctor of Veterinary Medicine and a Master of Science in Education with a minor in Counseling, all from Iowa State University. He also received a PhD in Poultry Science and Microbiology from the University of Wisconsin. So please help me in welcoming Dr. Scheer for his update.
So first thing I need to do is apologize for being late. I was supposed to go at 1:30, and here I am at almost 2:30. I apologize. I'm from the East Coast, and when they tell me my talk is at 2:30, I assumed it was 2:30, right? So I apologize. I have a presentation, but I'm going to talk off my notes for a little bit about some of the stuff that I just basically find very interesting. I think you will too. We all know that if we get FMD, African swine fever, any major poultry disease, as we've just got out of high-path AI in the United States, or we're just getting out of it, it's going to be monumental. Well, I can tell you if we get ASF, it'll be detrimental because it'll ruin our economy. It'll ruin everything that we've put together. It affects, the swine industry affects so many industries and employs so many people. I'm going to give you some statistics that even I didn't know. So let me just start off with some of this stuff. The U.S. produces 12% of the world's pork. That's pretty impressive. We also have 6 million feral hogs in 35 states in the United States. Keep that in the back of your mind because that's a very big concern if we get ASF. In 2021, NASA statistics say that we had 72.5 million swine in the U.S. If we look at the U.S. in regards to the rest of the world and as a pork producer, we currently rank third. In front of us are, I believe, China, and I'll give you the others in a second. So we exported in 2021 $8.1 billion worth of pork. So as I said, we're the largest exporter, followed by Germany, and we export 28% of our production. Remember that. 28% of our production gets exported. Why is that important? Well, the minute we get ASF in the United States, all that production stays here. So what's that going to do to the industry? What's that going to do to our economy? What's that going to do to our ability to slaughter that number of animals and process them and store them? So you can see what it would do to the pork prices and the swine industry in general if all that has to stay here. So in 2021, that equated to 6.4 billion pounds of swine or pork meat. That's not to count our other exports in semen, germplasm, and swine in general. So export-wise, I mentioned that we were first. Germany is second, followed by Spain and Denmark. Let's talk about Iowa a little bit. Iowa is the #1 state in production of swine and swine meat. We have 5,400 farms in Iowa. Now that's, if you look at the number of farms in 1950, that's an 8,000% decline in the number of farms we have. So what's that tell you about our farms and our Iowa farms? They're all integrated. Everything's integrated. They're big production facilities. The small guy is not around anymore very much. The backyard farms are still there, but in general, this is all integrated and company owned. And I'll talk a little bit about that in a few minutes. So over 18 million hogs were marketed in Iowa alone in 2019. I find that very impressive. So I'm going to go over some more figures really quick, and then I'll get into the bulk of my presentation. And I think this is important because it points to, as I'll talk about this disease and what it does, it points to what that does, what that'll do to us and our economy and why we need to prevent this disease and keep it out at all costs. I said I'd mention a little bit about production, and this is NASS data, so it's not like I'm revealing any major secrets about any company, but I found it interesting that Smithfield is our largest, has the largest number of sows in the United States. They're based out of Virginia, North Carolina, and Missouri. They're wholly and subsidiarily owned by a Chinese company called the WH Group. So we don't even own this company, but it produces a lot of swine in the United States. 55,000 employees, 40,000 are in the U.S. and 15,000 in Europe. In 2019, they generated, as a company alone, $16 billion in sales. They have 530 company-owned facilities in the United States, 65% of which are in North Carolina and in Missouri. And they have 2,100 contract farms. That's data based from 2018. I'm sure it's higher now. In the U.S., 130 million pigs were processed in 2019, 130 million. The U.S. pork industry estimated that it had a market size of about $19 billion and comprising about 26,300 businesses that encompassed about 54,000 employees. 1 out of 5 pigs produced in the United States goes overseas. So again, the export market is huge. In 2020, we had a record 29% export capacity. The top 5 swine-producing states are Iowa, Minnesota, North Carolina, Illinois, and Indiana. The top 5 breeding states are Iowa, North Carolina, Illinois, Minnesota, and Missouri. My final statistic, and I started on this and I didn't finish it. Top hog-producing countries, what do you think is number 1? Take a guess, it's pretty easy. China, absolutely. We're number 2, followed by Canada and Mexico. So, let's draw a parallel there. We get African swine fever in the United States, what happens? Our trading partners, Canada and the U.S., which, especially if it's in feral hogs, they'll probably get an impact from this too. We slaughter a lot of their hogs in the United States. In a sense, our industries are jointly run and held together. So I just wanted to start with some of that to get you kind of picture in your mind why this is important to talk about, or why Dr. Scheer is here from Washington, D.C. to help you. No, it's a joke. Okay, so what's at stake? We already talked about this a little bit. It's not just agriculture. It's our national public health, our food supplies, our economy, and our environment in general. Because if we get African swine fever, where are we going to put all those animals? The ones I just talked about. Are you going to bury them? Are you going to burn them? Are you going to compost them? Where are we going to get enough compost material to take care of that? This is it will be a huge problem. How do we even deal with depopulation? We don't have the people, we don't have the expertise. Most of the people that graduating, and this is not a dig, most of the people graduating from vet school now are small animal veterinarians. They don't know how to bleed a pig, they've probably never been around a pig. We won't even be able to do testing and surveillance because we don't have the expertise. Unless, and we're working on some of this in the Dominican Republic, which I've been spending the last 9 months of my life over there. We're developing new testing systems and new abilities that we could probably use in the U.S., and we're looking for the easy button. What's that company that has the easy button? Anybody know? Staples, absolutely. We want to be the Staples of African swine fever. So it's in 39 countries since 2000. It keeps moving. You know, what was the big deal in 2018? Everybody was scared to death because it was in China. China still has it, hasn't gotten rid of it. Big deal, okay? They developed a vaccine. The vaccine they thought would work. It doesn't work. All it does is it's created a new strain that is vaccine resistant. So they got a huge problem. Right now I'm being asked about the Vietnam vaccine. Should we use it in the United States? How many of you think we should use it? Raise your hands. Oh, packed house. Nobody thinks so. Well, I agree with you. I think the court's still out on vaccine. We need to do more work. So 39 countries. It's now 6 miles, of course, from France. How did it get there? Look at the jump. Here's where it was. Here's where it landed. How did it get there? Anybody know? Anybody want to hazard a guess? People, absolutely. People carried food that was contaminated, maybe from Poland, maybe from Germany. Who knows? It was in a sausage. They ate about half of a sandwich. They threw it out the door, got into the garbage. Somebody fed it to their hogs. It's a problem. It's a huge problem in third world countries and poor countries, which when I talk about African swine fever in the Dominican Republic and Haiti, you'll see my point. Okay? Simple question. Prevention is a key. We have to do, and we are doing in the United States, everything we can to prevent this organism, this virus, from getting into the United States. The biggest risk is we're not importing pork products, live animals from countries that have African swine fever. It's all mitigated out. It's all been blocked, right? But we have, in the United States, we have over 300 Dominican citizens that go to the Dominican Republic, spend their time on vacation, and I'm not blaming them, and coming back with sausage or some type of pork product in their bag. Now, they don't know any better. Why? Their country has chosen not to make it public that African swine fever is a problem and that it's in their hogs. So they don't think they're doing anything wrong. It behooves us and becomes our responsibility to keep it out. If you've been in the airport, you've seen the beagles that sniff the luggage. You're like, what's this little dog doing? Extremely important. We're putting other mitigations in place to keep that out. In Puerto Rico, if you travel through Puerto Rico and you get your bag checked through pre-clearance, many of you done that. If they find sausage or any pork product in your bag, they pull it out. You just can't, they won't allow you to fly into the United States. If the Dominican folks come to Puerto Rico with that stuff, they take it away from them. So those are the small mitigations that we have in place, besides surveillance, and I'll talk a little bit more about that as we go on, but we got to keep it out. And I've told you what the damage would be if it gets here. It can't be surmised. I just think we would be in big trouble. So we just got out of HiPath AI. Many of you know about that. It was pretty bad. 36 states had a positive of one. Oops, sorry. Big fingers getting in the way. 36 states had a positive of one type or another, backyard or commercial. We killed about 40 million birds, tremendous amount of birds. Cost over $500 million. Now the one in 15 cost almost $1 billion. But the difference was lessons learned. We learned that the faster you kill the birds, the less spread you have, right? So get them dead, whatever way you can. But don't do things that get you into trouble with animal welfare and that kind of thing. That's a whole other lecture for another time. Test as soon as you see signs. And once you see those signs, react. Get something done. Have your people ready. Personal readiness. Do they understand the disease? Have they been medically cleared? Can they get out on the farm? And what is their expertise? Have that ready. Process improvements. Make it easier for communication for people to get the job done. Who do I talk to? What's my connection? How do I move forward? I'm a farmer. I'm confused. They're telling me to do one thing with my compost pile, and I don't really think that's right. All those connections are extremely important. State involvement. The difference between 14 and 15 and the last outbreak is the states collaborated and communicated. States protect their information. They have to. There's FOIA reasons, and they can get sued. But to get this job done, disease doesn't respect boundaries. They don't care. And if you don't communicate between each other, you just don't know what's going on. And it's really hard to respond. Now, federally, we can communicate, but we have to have that state cooperation. They have to share that information, and this was monumental in this outbreak that they did that. So the state involvement is key, but I'm leaving something out. What would I be leaving out? What's important? Company involvement, producer involvement. You can't do this without those folks, and you can't do it well at all. They do the lion's share of the work. You give them the expertise and the guidance if they need it. Some of them don't need it. and you guide them through the process. And we provide, of course, the indemnity and the support to get the job done. So all those are important, and all those, you can't do one without the other. It's all integrated, and the collaboration is extremely necessary. So again, I say focus on prevention. We got to keep it out. So what are we doing in the United States? Well, we've increased our surveillance plan to look at high-risk areas. We can't surveil all the pigs in the United States. I was at a talk yesterday where a young man was talking about what we would need to do weekly to surveil all the swine in the U.S. for this disease. How many tests a week do you think that would be? 5.8 million tests a week. We don't have that capacity. We don't have the vets to do the testing. We don't have the laboratory capacity, so it's a challenge. So what we have to do is look at high-risk areas, focus on that commercial part of what's out there, as well as the backyard pigs, or wherever we think the high risk is. And we know, and I mentioned feral hogs before, that Georgia, Louisiana, Florida, and Texas have a lot of feral hogs. There are also coastal areas where what I call YOLAs, or illegal boat landings, occur. And believe me, we're working with the Coast Guard to intercept these folks, both in these states and in Puerto Rico. And how many landings do you think, illegal boat landings a year, do you think happen in Puerto Rico? Take a guess. It's over 300. It's huge. And those people are bringing their pigs, they're bringing their sausages, they're bringing everything they can get their hands on that they can transfer across and make a living once they hit the U.S. They're bringing it with them. So the Coast Guard is working with us. They've intercepted a lot of those boats. And when they intercept them, they repatriate the people. They're either coming from Cuba, the Dominican Republic, a lot of them from Haiti, and they just take them back and give them back to the authorities. And they destroy the boat. Because this is a business. These people make money taking these people back and forth. It's a business. So they sink the boat, destroy the motor, take the boat away from them, whatever. So we're doing that increased surveillance. This statement here, 11,400 samples tested through March 2022, 53 investigations. How many of you think that's good enough? It's abysmal, okay? We need to do better. We need to do more investigations, because this disease, African swine fever, looks like every other pig disease you've seen, okay? You can't differentiate it. And in the milder forms, it's very, very hard to detect. Okay, so you got to be sampling. What happened in the Dominican Republic and Haiti, along the border, pigs started dying. Okay, so they started sampling them. They sent us samples because we were doing the testing for them here in the United States at FADL, Foreign Animal Disease Diagnostic Lab. That's at Plum Island. We're doing that testing. We'd been doing it since 2019. Okay, hadn't found anything. Did quarterly testing. All of a sudden, they sent a sample to us, a group of samples to us, and said, "Hey, we got some funny death here with some of our pigs. Would you test these first 12 samples right away?" So we did. 8 were positive, okay? That was the start of it. Right now in the Dominican Republic, they have 32 provinces. How many do you think are infected? All of them. They're not controlling it. And they're not controlling it for a lot of reasons. Some are political, some are cultural. They got to feed their people, right? So we'll get back to that. So we've got to do better here, okay? So please, if you're a veterinarian, a person that works in the swine industry, and you're talking to people, we don't mind doing this testing, even if it comes up negative. It's a good thing to do. Now, can we go, if it balloons into 5.7 million tests, we can't do that, but we can attack the high-risk ones, the ones that when you walk out in that barn and you look at those pigs and say, "I didn't see this yesterday. This doesn't look right to me. I'm going to get some help." Even if it isn't what we think it is, even if it is an ASF, it's worth doing. Okay? I think I harped on that long enough. So, what's going on there? Got a little friction or something. So Hispaniola, same thing as Haiti and the Dominican Republic. They're the two countries together. They hate each other. Okay? They don't even talk to each other. So now you're sent over there as a U.S. citizen, and you're told with the government and said, "Okay, we want to get rid of African swine fever in the Western Hemisphere." Everybody wants to get rid of it in the Western Hemisphere. All countries in the Western Hemisphere are scared to death of this, okay? How do we think it got in there? They have a lot of ships from foreign countries that stop in at their ports and they offload their garbage. Garbage is a huge commodity in these two countries that they feed to their pigs, okay? Not all of them, but about 20% of the pigs in the Dominican Republic are garbage fed, about 80% in in Haiti. It's a cultural thing, so a huge challenge there. Even if we get rid of it, we got to deal with that cultural issue of how they're going to deal with the swine garbage. So we have to prevent it from leaving Hispaniola, okay? The United States, I would say, we're in pretty good shape. We have a lot of mitigations in place, not worried about it coming to the U.S. because they've had classical swine fever, which is a similar disease, looks the same when you look at the pig. They've had that since the 1960s, right? They've been vaccinated for it, and they kind of tamped it down, but they never got rid of it. And since that time, we've never got it in the United States. Why? Because of our mitigations that we have in place. So if we can find a way to even tamp it down and reduce it, which is where the vaccine comes in, maybe you can use that to tamp it down. I don't know. The court's still out on that, but if it works, that's my easy button. I'm going for it, right? I want to do that if I can find a way to tamp the disease down. If I don't have a DIVA strategy, which my understanding is the vaccine right now doesn't have that strategy, I can't test that animal to see if it was vaccinated, if it's infected, or both. I need that before. But otherwise, I have to vaccinate in Hispaniola forever. I can't quit, okay? So we want to tamp it down. Everybody wants to tamp it down. Movement controls in Hispaniola, they don't exist, okay? Even if you're infected, you can load your pigs up tomorrow, figure out what time the security guard goes off duty, which is 6 o'clock. They start at 6 and they quit at 6. Don't have to be a rocket scientist to figure out if you want to move your pigs. Just load them up at 6 and go, right? So we complained about that because we're just about to enter into a huge indemnity process with the Dominican Republic. And my take on that is you can't put indemnity to animals when other people are moving infected animals. You're pouring water down a hole, right? And that hole gets pretty deep. So we said no indemnity until you fix those movement controls. They brought in the Army. The Army's now at 20 posts checking these around the clock, 24/7. They have to be permitted to move. These are the kinds of political things that we have to do. We can't tell them to do stuff. We have to ask them. It's influence. And what's our influence in the Dominican Republic? Just money. That's it. Now, they listen to us. I'm not saying that. They do, because we have pretty good experts sitting aside them or across from them telling them how we would do it in the U.S. Of course, that doesn't always get accepted. Politically, sometimes it doesn't get accepted. And sometimes politics enters into whether he's positive or not because he's got connections. Okay, so we got to look at that too, and we work with the lab very closely to determine, is that guy truly positive? Why are we retesting? Why is there a call to go out and retest that guy when this guy was positive and we didn't retest him? Politics. So we have to watch that. Controls at the border. The border between Haiti and the Dominican Republic is very porous. You can walk right across. There's nothing to stop you. You can take your animals. Several Haitians, this is where this disease came, they think had set up a living quarters just across the border. There's a little river that runs into a banana plantation along the border in some places, and those people were living there. On this end, they had their pigs housed in such a way that they were defecating into the water, same water that they ate and drank out of along that border, right? Their pigs then down here got infected too. Is water a source of infection? Could it be? Well, we don't know, but we should probably look at it because we don't raise our hogs that way. There's still that issue is if that virus survives in water, how far is it moving? So we're going to look at all that kind of stuff in the Dominican Republic. But we also have to enhance put a surveillance plan in place, both in the United States and in the Dominican Republic and Haiti. Haiti's a huge problem. I'll talk about that in a little bit. A biosecurity and containment plan that works and that we can actually implement and that they can handle. They have 6 veterinarians in Haiti. That's what they told me last time I met with them. 6. And they all work for the government. The rest of them left. Why did they leave? It's a horrible place. They're really struggling as a country. A lot of crime. It's dangerous. When they had the earthquake and the last hurricane, a lot of the soil washed into the water, put a lot of farmers out of business. They moved into the city of Port-au-Prince, which is the biggest city, the only city. There's nothing there for a livelihood, so people do the best they can. They steal, they kill. They're trying to stay alive. And there's no stable government. You heard the president got assassinated. That happened, and the government, as far as I know, I met with the agriculture commissioner, and there just is no stability there. So we're going to try to enhance this biosecurity and containment. We can do that, I think, in the Dominican Republic. We can do that in the United States, and we are doing it. But to do it in Haiti is going to be a huge challenge, huge challenge. Even if we put a good plan in place, they can't implement it. So what are we doing this with? We got about $500 million from the Office of Management Budget because our secretary, who is an ex-governor of Iowa, Mr. Thomas Vilsack, went and got the money for us. It was unprecedented the way this happened because usually to get the money, we wait till we're in the middle of a disaster and then we go ask for the money, and it's almost too late then. He went ahead of time and said, this is going to be a disaster. We've got to do something to limit it in Haiti, limit it in the Dominican Republic, and protect ourselves. So that money is serving that purpose. We're putting a lot of things in place. You might have heard about the protection zone that we put in place for Puerto Rico and the U.S. Virgin Islands. That's a new concept out of the OIE, or WO as they're called now, the World Organization of Animal Health, that says if you have an area of your country that you suspect is at high risk for disease, and you want to put certain mitigations in place to keep it from getting there and to protect the rest of your country in case it does, then the rest of your country will not lose its status. So with our export market, we needed to protect that, and we needed to protect the Puerto Rico. So we did put it in place. And the funny thing about it is, OIE can say, well, we don't believe in it. They don't make a judgment. They just put it out there. And other countries have to decide whether they're going to accept it or not, okay? So we have to petition all those major countries that we export to and say, here's what we're thinking of doing. Are you on board or not? So that's where it's at. And we have already done that. Most countries are like, they haven't given it. But it hasn't gotten into Puerto Rico yet. We'll wait and see what happens then. And we don't think it's going to. Again, I think our mitigations will keep it out. I'm 2 years from retirement, and if it comes to the United States, I'll file my papers. So, again, we're prohibiting those things from coming from Puerto Rico and the U.S. Virgin Islands. Live swine germplasm, of course. We are testing. We're doing surveillance like crazy in Puerto Rico. When the YOLO boats land, we do surveillance all the way around them for all animals that might have come in contact with those if they get on land itself. We do slaughter surveillance in that country, and that's ongoing constantly. We routinely test their garbage. They do a garbage feed, but they don't feed meat. That's the difference. We routinely test their garbage-fed animals, so that's all in process. And there's just, like I said, about the pre-clearance and leaving Puerto Rico, all these things are in place. And it's worked in the past, and we have even more going on than that. U.S. Customs and Border Patrol or Protection, I don't know which it is, they're a great partner. They're helping us. They're inspecting and intercepting a lot of the meat that's coming into the United States, as well as at the borders. They're working hard there. The biggest thing, I think, any of you been to Puerto Rico in the last 5 years? Anybody? Okay, did you see any of the pot-bellied pigs walking around, pooping all over? You didn't? Well, when I went there, I try to go there every so often, but because we have we have really good people there that work for us, and I try to go on and just show them the importance of what they're doing. Okay. We got off the plane and got in the car, and we were driving around, and I saw these pigs walking around the coast. They're Vietnamese pot-bellied pigs. What happened is in 2018, Hurricane Marie came through, and it knocked down a lot. They still haven't recovered from that. They knocked down a lot of their buildings, and they had outdoor pigs, and they all escaped. Okay, and people let them loose because you start out with a cute little pig like that, and gets to be 200 pounds, and it's like, geez, I can't keep this in the house anymore. So they let them loose. They set up a breeding population all along the coastline, mostly in the cities. Why? Because that's where all the food is, right? That's where the garbage is. We killed most of them already. I contracted, before this ASF even came, I worked with our wildlife services people and said, that's a bad deal. I'm going to talk to the Secretary of Agriculture and ask him if he wants our help. So I did, and he said to me, Dr. Scheer, you kill the pigs, I'll dig the hole. And so we started killing pigs. And right now, that's at the level where we can't detect them anymore. So think of a huge breeding population that was snatching food out of kids' hands in their own neighborhoods, pooping everywhere. It was a disaster. We have removed almost all the feral pigs from Puerto Rico, and that includes their mountain feral pigs and the Vietnamese potbellies. That's part of our program. And we've removed them from St. Croix and St. Thomas. Am I running out of time? I can sit down anytime. Okay. So we are monitoring them on the, I've said all this already. We launched a huge information campaign, not only in Puerto Rico, where we used social media, we used Facebook, we used TV, radio, to talk about this disease. That's not been done in the Dominican Republic or Haiti. So you've got a populace there that really doesn't understand or know what's going on with the disease. And why? Because they're afraid they'll stop eating pork if they find out. But that's not true. They will not stop. It's all how you handle this. And that our Protect Our Pigs campaign has a lot of information. If you get a chance to go on the website and go take a look at that, just if you can't remember Protect Our Pigs, just go to the APHIS website and look up Protect Our Pigs. A lot of information there that you can glean, and it will help you understand ASF a lot better than I can explain it, and just get the goods on it. There's also materials that you could use if you're a farmer on your farm, diagrams, posters, that sort of thing. You run them off. I've talked about the rest of this in the K9 teams. We are doing functional exercises all the time to fill the gaps. Playbooks on how to deal with feral swine. We have 2 playbooks, one on feral swine, one on domestic swine, and they're very helpful. And again, I talked about using lessons learned. What did COVID tell us? What did we learn from COVID? We don't have enough people, right? And if people get sick and don't show up, you better have somebody. What about that slaughter plants? What happened? Some plants went down to less than 19% production. That's scary. I remember going into the grocery stores, there wasn't any meat. Because people were sick and people were scared. And they didn't want it. So, again, those are kind of things that we learned. And the other thing we learned is people don't go to work if they don't want to. Their health is more important to them than making a buck, because if they die, they don't make anything, right? They're just dead. So COVID taught us a lot about our supply chain. We're still having supply chain issues on many things. I was just talking to a lady, and she said, you know, and this is going to sound crude, but I don't mean it to be crude. I can't buy tampons. They're not available. Oh, my God, that's a basic human element that you need, and we're not able to keep those supplies going. Anyway, and we are working with our stakeholders very closely to address these gaps. We've had numerous calls over the last 2 years, and we have a team working on the slaughter plant and rendering issues, and a team working on the gaps for the industry, the gaps that the states have, and the gaps that the government has, because no one entity is going to fix this thing. And now we have we're getting huge help from the pork industry. They're stepping up, and they're helping us with a lot of this work and a lot of the definitions and a lot of the ideas that we have, because they've got good ideas. You get a little stale in government. Again, filling the gaps. What are we going to do to depopulate? Where are we going to put these animals? Do we have the right response equipment? I don't know. I don't think so. Workshops and exercises teach you a lot, but you've got to be able to. What they teach me is I need to know who to call. Who's going to help me? Who's got the goods? And then there's NADPREP. Many of you know about NADPREP. That's a farm bill operational thing. We have that available, and we are hoping that people will submit projects, mostly in the issues of the gaps and how we can fill them. That's due by September 9th. And please, if you want to teach us something, do one of these projects. I think that's about it. Here's some sites you can visit. I appreciate the extra time if I ran over. Okay, thank you.